Hi, my name is Carol Finn, and today I'm going to be talking about cranial nerves, specific numbers for those, and are those specific numbers more effective than the 396? I'm going to be using several case studies that I've used on the cranial nerves and the eye muscles. So, okay. Did you ever come to a new way of thinking or a new way of treating because you had a bunch of different things coming at you from different angles well, that's what happened to me. I had a headache on a patient I couldn't touch. I'd run everything. Number two, I was studying for the brain injury specialist exam. And number three, Dr. McMakin showed me her prism glasses, and all three of these things kind of came at me at the same time, creating the new idea of treating the cranial nerves specifically. And I want to give credit to Gary Griffin, who gave me the specific numbers for the cranial nerves. Okay, so Sarah is my patient. She was in a motor vehicle accident. She had problems with concussion, headaches, neck pain, left shoulder and left side pain, and weakness in that left side. And her neck pain was in the back here. So I tried 13 on 142, 62, 77, and 97 with active fascial work, and there was a lot of improvement. And we did several sessions getting more results each time. It was very exciting. I came home from FSM conference and ran Vegas. She was very sleepy. And at the end of the session, she said that it was the first time her shoulder hadn't felt locked forward since the accident. I was always running brain protocols for her concussion and pain. Everything's improving, movement's better, there's much less pulling, her left arm is stronger when she's exercising, her headache and neck pain are better, but they are still there. What else can be done, and what am I missing? So then I went to the advanced in 2022, and Dr. McMakin greeted me, and she said, "You have to see this." So I had my hands on her neck and shoulders, and she put her prism glasses on, and her neck and shoulders just softened. So the eyes affect the neck and shoulder muscles, and it makes sense. If you're straining to make your eyes work and they're not working together, it's going to affect your neck and shoulders. I was also studying for my certified brain injury exam, and I was introduced to cranial nerve and turned the page, and there they were and what they do, and I thought I was going to study them for the test and be done with them. Silly me. So then I found the FSM notes from Gary, and here they are. I'm not going to say each one of the FSM, but here they are. But we'll go over them. My cranial nerve 1 is your olfactory. It's your smell. Cranial nerve 2 is your optic. It's your eye. Cranial nerve 3 is your ocular motor. It's your eye. Cranial nerve 4 is your trochlear. It's your eye. Cranial nerve 5 is your trigeminal. Cranial nerve 6 is your abducens, which is your eye. I love the eye. It goes 2, 3, 4, and 6. They're kind of easy to remember. Cranial nerve 7 is the facial. Cranial nerve 8 is your vestibular cochlear, which is your ear. Cranial nerve 9 is your glossopharyngeal, which is your tongue. Cranial nerve 10 is our favorite. It is Vegas. Cranial nerve 11 is your accessory, and cranial nerve 12 is the hypoglossal. It's also your tongue. Just a note in passing, there's an argument about cranial nerve 11, whether it's really a cranial nerve, but anyway. So they are broken up into different systems, and sometimes a cranial nerve will be in more than one system. So the auditory system is your cranial nerve 8, your vestibular cochlear. It impacts hearing along with the external ear function and conduction. Anybody with a TBI injury is probably going to have this affected because they're balanced and everything else. Your autonomic nervous system is cranial nerve 10. Your vagus provides parasympathetic control of the pharynx, larynx, thoracic, and abdominal viscera. Cranial nerve 7, the facial, it provides parasympathetic control to the glands of the head, except for the parotid and the integumentary. The gustatory sense is your cranial nerve 9, the glossopharyngeal. It has a loss of sensation to the base of the tongue, and it can impact appetite. It's the posterior 1/3 of the tongue. The cranial nerve 7 is your facial, which is the loss of sensation to the anterior 2/3 of the tongue, and it also can impact appetite. Olfactory. It's your smell. Cranial nerve 1, olfactory. It's loss of function of the olfactory nerve and can notably reduce a person's appetite and impact safety awareness, as in the event of fire. Swallowing. Cranial nerve 9 is your glossopharyngeal. It's the motor to your swallowing muscles. Our cranial nerve 10 is your vagus, the motor and sensation from your pharynx and your larynx. Cranial nerve 12 is your hypoglossal. It's the motor to most of the muscles of your tongue. The vestibular system is your cranial nerve 8, the vestibular cochlear, and impacts balance along with your inner ear function. It also is linked closely to the visual system. So your visual system is cranial nerve 2. It's your optic. It controls the visual acuity. Cranial nerve 3 is your ocular motor, and it innervates 3 muscles and is responsible for moving the eye in, up, and down, as well as pupillary and other reflexive responses. Cranial nerve 4 is the trochlear, and it innervates the superior oblique muscle and moves the eye downward with inward rotation. Cranial nerve 6 is the abducens, and it innervates the lateral rectus muscle and moves the eye outward. If injuries occur unilaterally, a person often has double vision. And then your eye muscles are your recti muscle is 135, 136, and 137. Your oblique muscle is 138 and 139, and your ciliary muscle is 134, 836, and 976. I like the eye muscles because they mostly go in order. And I was really excited when Eduardo did his presentation on working on the eye muscles. I thought that was very exciting. So, with all the information about what the cranial nerves are and do, and we're going to start using it. We're going to give it a try. So, again, my patient Sarah came in, and I explained to her that these are investigational numbers. I had no proof, and she said, let's give it a go. So I did do the cranial nerve 6, as she has convergence problems. Her eyes, this one eye goes like completely in. I ran 60 hertz for 2 minutes on a gentle slope. I was easing my way in. That's 725 on 336 and 436 on 446. I had nothing else running. I had no other machines on her. Nothing was going except for cranial nerve 6. She fell asleep immediately, and we got total smush. At the end of the session, uh, she could read small print more easily without her tricks and strain. Following week, she reported that her headache was less. That's that headache in the back I couldn't touch. And her prism glasses felt too strong. Her computer work was easier. So that week I did the eye muscles, and we also got that result. And then in following weeks, I did cranial nerve 2, 3, and 4. So she was just, her eyes, her sight, and her neck, and that pain in the back were all getting better. And they were the only things I was running. Okay. I wanted to give you a picture of the eye muscles, where they are located. So my next patient is Joyce. She also had a pain in the back of her neck that I was having trouble. And I thought, oh, it's just like Sarah, this will be easy. So she has neck pain and hurts to lay on her pillow, and her range of motion is restricted. She's also had eye muscle surgery. Her prism glasses are 12, and so they're very strong. She has different eye problems. So I ran cranial nerve 6 and got no response. There was nothing. So okay, now what? Cranial nerve, they're cranial nerves. So I tried it with polarized, and I got smush. So 725 on 336, 436 on 446 for Joyce needed to be polarized. It's a nerve, so it's polarized. It might work better. I did get a lot of change from Joyce, but she has other issues. But I did learn that sometimes it's polarized. Amy, motor vehicle accident with scoliosis and migraines. Her migraines are doing better because of the diet change. She also wears prism glasses. So cranial nerve 6, and it started a migraine that she didn't have when she came in. So I stopped and ran migraine. We haven't tried it again. I don't know if the cranial nerve started it. Is it because she has scoliosis? I don't have any answers for that. But I wanted to put it in because it was part of the study. Mark. Now, Mark works for, anyway, he had an engine fall on top of his head. He was knocked backwards and hit his head again. He has convergence issues. He's been wearing prism glasses. He has an FSM device and has been treating himself, and he's only coming in every 3 weeks. His headaches have lessened. His neck is still really tight. He doesn't have the range of motion. His head is just kind of stuck in there. Of course, if you have an engine fall on there. I did try scarring and didn't really do anything. So I treated his eye muscles, 40 and 124 on 134 to 139. And I got smush, especially in the back of his neck. Then I did the cranial nerve 6, the 725 on 446, and the 436 on 446. I got smush, and his neck is more mobile. The range of motion is improved. He's able to turn his head. In following times I've done the cranial nerve 2, 3, and 4. Mark has been dismissed, but I did go up to the front one day, and he was checking in to see a doctor to do a follow-up. And he's saying to the girls, look, I can turn my head. Look at me. So he's very excited to have all of that range of motion back. And it really didn't get it until I ran the eye muscles and the cranial nerves. So Lillian, um, 68 years old. She fell on ice and hit her head. She was unconscious. She was not sure for how long. I've seen her for concussion issues that have really cleared up. I consider her a successful case. She's begun traveling with her husband again. She's done missions trips. She's babysat for her 9 grandkids, with 6 doing online school during the pandemic. I think that's amazing. She has her own device and uses it faithfully, but she still has some problems with swallowing. Her neck has been stretched several times. I did contact the FSM speech therapist, Dr. Thompson, who suggested 13 on 142, 62, and 77. I ran that, and there was not a lot of help. So, with that in mind, Lillian came in and I explained these new cranial nerve numbers that I had and that they were investigational, and she said, let's do it. So I tried cranial nerve 9 and 12, 9 being 976 on 538 and 986 on 728. And cranial nerve 12 is 727 on 527 and 834 on 346. So these have to do with the motor aspect of swallowing and the innervation to swallow. So it was really kind of hard to tell whether there was a difference. So a month later, she came back and she mentioned, when I'm taking, how is everything? Oh, so casually, oh, my swallowing seems to have really improved. The only problem I have is when I drink something cold and eat something hot. I'm like, yes. So cranial nerve 9 and 12 improved the problem with swallowing. And in the past, I had run basic nerve. I had run the brain parts that have to do with swallow. I ran anatomical parts that have to do with swallow. I wrote a protocol that had all of it in there. And nothing really improved until I ran the cranial nerves 9 and 12 that have to do with swallow. Lillian came in another time with dizziness problems. She'd had that at the beginning and was past it, and came back in, and she had been bending over picking up sticks for an hour. Bending over has been a little bit of a weakness for her. So dizziness, cranial nerve 8. I ran 40 on 1 and 124 on 114 and 137. Let me just say that some of the cranial nerves are in pairs and some are not. I don't know why. Anyway, she was much less dizzy. She slept that night for 14 hours. She usually sleeps 8 to 9 hours. She said when she got home, she had run Vegas, cranial nerve 10, and concussion. Her balance was much better when we were done with the session, and she was much improved at the end. So that was really exciting to see. So here's a picture of the cranial nerves. Just kind of pointing to where they are, where they go to, what they're doing. I'm not going to go into them, but you have that on your slide. So Ben had a concussion. He is a large man. He weighs 425 pounds. He has a concussion with typical concussion problems. He does have a diagnosis of cervical dystonia. His neck pain and headaches. He's a new patient, so I dove right in and started treating with concussion and different brain parts, the forebrain, the hindbrain, the dura. And then I did treat him for cranial nerve 6, 725, 336, and 436 on 446 because he wears prism glasses. And I then The next time I treated his eye muscles, I ran 40, 294, and 124 on 134 to 139. His neck really relaxed. There is some tightness remaining, but I did find that running those cranial nerves and those eye muscles really seemed to make a difference in how tight it was. Jamie. Jamie is my work comp patient. She was trying to calm down a special needs student. He gripped her arm and whipped her around. She has a diagnosis of cervical dystonia. She has spinal injury with surgery, neck and arm pain, and concussion. So I had been treating her for a while and then learned about these cranial nerves. So I ran cranial nerve 9 and 12, and her neck just melted like hot butter. I was also at the same time running dystonia and pons. I had run dystonia and pons before without the cranial nerves, and it never loosened her neck up quite like this. And she said it remained loose for 3 days. She has other complications, but these are giving her relief. I did cranial nerve 9, 41, 24, 294 on 114, 137, and cranial nerve 12, 727 on 527, and 834 on 346. I also did cranial nerve 5, which is 218 on 714 and 916 on 514. She always would complain that her ear felt like there was this balloon. It was tight there. So I ran that. Her ear loosened up. So I was not running the cranial nerves completely independently, but I was running it with other protocols that I had run before, and I still noticed a big difference. Christine had a recent fall and concussion symptoms. Her eyes were doing weird things. Her sight was off. I ran 40 on 134, 139. I started running 294 on 139, and it started to hurt over her eye. So I turned it off, stopped, and I said, "Did you have a headache when you came in?" Because she hadn't reported that. And she said, "Well, I had a slight pain over my eye." But she said, "Go ahead, do this." So I did have protocols, concussion, myotherapy, and ERB running. When we were done with the session, her right eye felt like it had more movement. It was freer. Her left eye, not as good. She was in an old motor vehicle accident and hit her head on the left side. So does she need something different? She got a slight headache when I started the 294, but 40 was okay. I don't know. So, I do want to add, I know that it says I have a lot of concussion people in here. Well, one of the doctors I work with is a TBI doctor, and so I get referrals. I have had concussions, and so I get people. So I think having concussions is those are good patients to be running the cranial nerves on. Anyway, if you would like to try these out, I would be really excited to hear what you found when you ran them. I put my email in, and if you want to email me and tell me what you found, I'd be really excited to hear. But thanks for hearing. Thanks for listening. Bye.